Thank you for joining me this evening. Tonight we're going to talk about breast cancer promotion and prevention. Breast cancer was once thought to be poor luck, a deadly diagnosis. There's no way to prevent it. You just got it and that was it. However, that is no longer the case. There are ways to prevent or screen early stages of breast cancer, which improves your health. By attending this lecture today, you're already on your way to educating yourself, which is the biggest part of health promotion. I hope you can use the information you learned today to better educate yourself and screen yourselves early and pass that information on to your loved ones. I'm not only a registered nurse and have seen people affected by breast cancer in my practice, I've also been personally affected by it in my life. Both my grandmother and my mother are breast cancer survivors. So I have seen how risk prevention and promotion has positively impacted their health. You may be familiar with some aspects of breast cancer. It's a very common diagnosis in American women. I'm not going to go into all the medical details. However, we are going to talk about some risk factors, some screenings, and some ways to prevent and take care of yourself to prevent the development of breast cancer. So to begin health promotion, you must first assess your risks of developing breast cancer. There are personal background traits, such as the ones listed on this slide, that you may or may not be able to influence. For example, having 2 X chromosomes, being female, will greatly increase your risks of breast cancer. It is well known that males they are able to develop breast cancer. However, it is a much more common diagnosis in women. Increased age, not having children at a young age or not having any children, also increases the amount of time you're exposed to estrogen, which is a hormone that has been found to play a big role in the development of breast cancer. Beginning your period at the age of 12 also gives the body a longer exposure to estrogen, which is something that's not preventable. There are hereditary factors that also cannot be changed, such as genetic mutations. The BRCA1 and BRCA2 gene have been identified as major players in the development of breast cancer. However, only about 8 to 9% of the population have those genes, and however, if you have those genes, you're more likely to develop breast cancer, but it is an uncommon mutation in our population. For having a first-degree relative also increases your risks and would further you to seek genetic testing. Just like eye color or hair color, it is passed down through your mother or your father. There are environmental influences that can sometimes be manipulated but are not always preventable, such as exposure to radiation on your chest at a young age, whether it's for lymphoma treatment, such as types of cancers, or any other radiation, will increase your risks. But there are changes that you can make, such as smoking and obesity, alcohol consumption, and using hormone therapy in menopause, that you can play an active role in manipulating to prevent breast cancer development. These are just a few of the risk factors of breast cancer. Like any other cancer, there's a multitude of factors that come into play with developing breast cancer. Since most people do not seek medical care until there is a problem, it's important to note the subtle signs and symptoms of development of breast cancer. There are some questions you could ask. It might be a change in the breast feel. Usually an intimate partner is one of the first people to notice breast lumps, changes in the skin, such as a lump on one side of the arm that's greater, some pitting in the skin. Any of those changes should warrant a health professional to come check you out. There's also swelling on one side is also uncommon. Any discharge from the nipple, unexpected or sudden, red, bloody, clear, should also be looked at. So if you or a loved one are suspicious of breast cancer and have any of the symptoms that we talked about, it's important to get a professional health clinician to examine you. Self-breast exams have been promoted as a great way to screen. However, a clinical breast exam is the best screening method for anybody to do on a yearly or a more frequent basis if there are concerns. A trained medical professional can detect lumps that you may not be able to detect yourself. The golden standard for breast cancer diagnosis is a biopsy. A biopsy is when a physician examines the cells in the tissue that have been extracted surgically to look for cell changes that are indicative of breast cancer. The current guidelines recommend by Healthy People 2020, which is endorsed by the U.S. government, is that women in their 20s or 30s with no increased risks should also have a mammogram every 2 to 3 years. However, if you have increased risks or over the age of 40, it is recommended that you receive a yearly mammogram. If a mammogram does show an increased mass or a positive result, they will most often continue to a biopsy to diagnose it correctly. If you are at a greater risk and you and your physician have decided that you're more likely to develop breast cancer, BRCA1 and BRCA2 genetic testing are available for the general public. However, having one or two of the genes does not always mean you will get breast cancer, so there are some psychosocial and your own feelings that you can look at to see if you want to get tested or not. It is estimated that 1 in 69 women over the age of 40 will develop breast cancer within 10 years. Aside from the recommended genetic and screenings, as well as counseling, there are steps you can take to promote health. Nutrition and exercise, such as maintaining a healthy weight. Obesity, as we said earlier, greatly increases your risks. Fat cells do store estrogen, which is one of the mechanisms of developing breast cancer, as we talked about earlier. A diet rich in fruits, vegetables, and vitamin D has been proven to reduce risks of breast cancer. Limiting environmental exposure is also important, such as smoking. 85% of breast cancers do occur in females with no family history of breast cancer. Many of those were the preventable factors. Exposure to radiation, chemicals, pesticides, and hormone therapy, organic solvents, smoking are all factors that can mutate those cells and cause breast cancer. While there is ongoing research, it's still just best advised to avoid exposure to those chemicals. Breastfeeding is actually a way to prevent breast cancer that is not well known. The way that works is similar to the estrogen exposure. When you're breastfeeding, you are not menstruating, therefore you're not as exposed to estrogen as you normally would be, which prevents the length of time that you're exposed to the hormone, which can prevent breast cancer as well. So as you've learned in this lecture, breast cancer can occur due to multiple factors that all play together. Some are preventable, some are not. However, breast cancer rates have been decreasing by about 2% every year, and this has been a decrease since the push for health promotion and health prevention. Still, 1 in 8 women will develop breast cancer in their lifetime. That is a high statistic. So it is important to make those changes to prevent any development that you could, or screen early to prevent progression of the disease. If caught at an earlier stage, it is much easier to treat with it and has a much higher recovery rate. It's a lifestyle choice that you consciously make to prevent cancer. In 1902, Thomas Edison, a man that was way ahead of his time, was famously quoted for stating that the doctors of the future will give no medicine, but will interest his patients in taking care of the human frame, in diet and causes, and prevention in today's healthcare framework. Prevention of a disease decreases the need for treatment. The choice is clear. Making small changes that will influence the rest of your life are worth it to prevent a cancer diagnosis. Any questions?
No.
All right, thank you for joining me this evening, and I hope this has helped you learn more.
That was long enough.